Question number 2, Stuart McMillan.
Thank you, Presiding Officer. To ask the Scottish Government what discussions it has had with NHS Greater Glasgow and Clyde regarding dental provision in the Greenock and Inverclyde constituency.
Minister Jenny Minto.
The Scottish Government continues to work closely with NHS Greater Glasgow and Clyde to understand its plans for dental provision, including mitigations for practice closures. Current plans include a pilot within the Greenock and Inverclyde constituency to provide emergency dental services in Greenock Health Centre. In addition to targeted local action, Inverclyde also qualifies for national support schemes, such as the Scottish Dental Access Initiative, which pays out up to £100,000 for establishing, relocating or extending practices, and recruitment and retention allowances, which pay up to £37,500 to new dentists in the first 3 years of practice.
McMillan.
Thank the Minister for that reply, and the Minister will be aware that the dental practice mydentist wrote to their thousands of patients last week to tell them that they will be closing on the 9th of August, and as per my email to you yesterday, Presiding Officer, I want to inform the Chamber this company is my dental practice. But this closure affects both private and NHS patients, but particularly NHS patients, because yesterday my office called every dental practice in Inverclyde and found that none are currently taking on any NHS patients, apart from one, which is taking on new NHS patients under 18. So can the Minister advise what the Scottish Government is doing to ensure that my constituents have access to an NHS dentist, if that is what they choose?
Minister.
The Scottish Government is committed to maintaining access to NHS dentistry in Scotland, and our reformed fee structure has been designed to make continued delivery of NHS care more attractive to independent practices. Despite our significant reform, I acknowledge that access remains challenging in Greenock and Inverclyde, and therefore, as I set out to the member in my previous response, my officials are building closer working relationships with NHS boards, including Greater Glasgow and Clyde, on localised matters to ensure there are mitigating actions to support access to urgent and emergency dental care, while also supporting boards to be innovative and flexible.
Stuart McMillan.
Thank the Minister once again for that reply. And I, like many of my colleagues, have been raising issues regarding the dental sector for some time, especially since they have been exacerbated by the COVID pandemic. And these challenges are not exclusive to Scotland. And anecdotally, I understand that we, Scotland, are still in a better position than other parts of the UK. But however, we cannot be content with how things are at present. And I know the Scottish Government is working with the sector to make NHS dental work more desirable for practices and also to encourage more people into the profession. But nonetheless, can the Minister advise on the current model used to remunerate dentists who carry out NHS work? I know it's something that a point that was raised when the Minister visited the Weir McClafferty dental practice in Greenock earlier on this year.
Minister.
Thank Stuart McMillan for his question, and I found my visit to Weir McClafferty very informative and really re-emphasised to me the importance of having dentists on our high streets. Mr McMillan is also right to reference that this situation is not unique to Scotland. But we have a strong track record in recruiting dentists, with 57 dentists per 100,000 of our population compared to 42 in England, 46 in Wales. We delivered a significant intervention through the introduction of root and branch NHS dental payment reform on the 1st of November 2023. This preserves the activity-based payment which dentists are used to, but updated fee levels to ensure they are reflective of the increased costs of modern dentistry. In this way, we aim to provide longer-term sustainability and encourage the dental sector to increase its existing NHS provision. Our reform has been largely welcomed, well received by dentists, and I'm encouraged by the positive actions from the sector as they continue to get on with the job of providing NHS care to patients.